Good afternoon. My name is Lali Yvang, and I'm a registered dental hygienist here in Minnesota. On behalf of Hope Dental Clinic, I am here to provide you guys with good, proper oral hygiene instruction, also known as OHI, through these short videos. For the next few weeks, we're going to talk about proper nutrition, toothbrushing, manual versus power toothbrush. We're going to also talk about toothpaste, which one works best for your needs. We're also talking about flossing techniques, water flossing versus string flossing, and mouth rinses, the various types, whether you have dry mouth or if you need fluoridated mouth rinses, and also a little bit about tongue scrapers. Now, for today, we're only going to focus on toothbrushing technique. And so to have proper oral hygienes at home, we gotta know how to brush your teeth properly for the effective removal of biofilm bacteria, and also a little bit about flossing technique as well. Now, it's important to have good OHI at home so that you aren't going to be experiencing toothaches from like tooth decay, gum disease, and possible dental infections. So with no further ado, we'll go ahead and jump right into brushing. Okay, so now we're going to demonstrate proper brushing technique with a manual and also with a power toothbrush. So first we're going to start with a manual toothbrush. Now, brushing your teeth, a lot of patients feel like brushing harder is better and brushing with a hard bristle is better, but that's the total opposite. You always want to choose something that's soft, and then also start with small strokes. So when you're using a manual toothbrush, you always want to make sure that your toothbrush bristles are at least partially on your gums and then the majority on your teeth. And so when you're brushing with a manual, you want to go small circles, and I would say usually 3 to 5 seconds per section. So if your toothbrush looks more like this guy and it's covering at least 2 teeth at a time, I would just say 3 to 5 seconds, circular motions, and then move forward. Okay, now if you're brushing with a power toothbrush, you might think, oh, we're going to do the same thing, but we're going to use the power of the sonic toothbrush by letting it glide. It's going to be a little loud, but letting it glide on your teeth and on your gums 3 to 5 seconds, and then glide forward. As you can see, I'm only going gliding, and I'm not scrubbing or going back and forth, because over time that can cause recession. In a little bit we'll go over what recession is. Okay, so now we're going to go more in detail on how to brush the parts of your teeth, like more the front. Now, a lot of patients think that I am brushing, horizontal on the outsides, and that it may be just as good to do that on the inside of your teeth. Now, right now we're focusing on your front teeth, and as you can see, the toothbrush bristles aren't covering the backs of your teeth. And now earlier we learned that pressure is not always the key, and so for proper bacterial and plaque removal, you would want to have your toothbrush more at a vertical angle so that you are sweeping everything in between the teeth versus missing the backs of the teeth. And that goes along to say for the bottoms of your teeth, you can brush horizontal on the fronts of the teeth. But then again, when you're brushing on the backs of your lower teeth, you would also want to arch your toothbrush in a vertical manner and sweep up and back and forth as so. Okay, so now that we've completed the demonstration on proper brushing, I'm going to go talk a little bit about recession. So when you are brushing too hard towards the gums, and then using a bristle stronger or harder than, or more aggressive than a soft bristle toothbrush, recession can happen. And what recession looks like in this photo here is your gum lines are receding based on the pressure of toothbrushing. Recession can also happen with orthodontics, clenching and grinding, but I would say for the most part, recession does come from brushing too hard, and this is what we call toothbrush abrasion. So now we're going to jump right into flossing. Today I have wax floss with through Listerine, and then I have unwaxed floss from Oral-B. So we're going to use this typodont to demonstrate proper floss technique. And now when you are grabbing floss from your container, you also want to grab at least, I think it was 12 to 18 inches, and you want to start wrapping them around your middle finger, like so. And when you're wrapping it around, you want to have enough space to go in between your teeth. So on this typodont, the floss technique is called C-shape, and what you'll do is wiggle the floss gently in between each tooth until you're in between the teeth. And you're going to choose one tooth to work on at a time, so you're going to put slight pressure against one tooth, and then go down and swipe into the sulcus, which is below the gum surface, up and down 1, 2, at least 3 times. You're going to go to the next tooth and put pressure, slight pressure on that tooth, and demonstrate the same way. 1, 2, 3 swipes. You're going to come back up and then choose a different part of the floss that is just clean and work on the next tooth. And the reason for that is that when you're doing the C-shaped floss, you're dirtying up a small section of the floss. Now you're going to grab new floss that's clean, so you're not introducing one bacteria from one pocket and then making it go into the next pocket. So that's also very important. So you're just going to floss the same way, whether it's the backs of your teeth or the fronts of your teeth. You're going to still continue that C-shaped motion. And so now I'll demonstrate with unwaxed. Now the unwaxed floss, it's going to feel a little bit more like satiny finish, kind of like Teflon, so it's a little bit stretchier. It's not going to be as strong as wax floss. And so you wrap it around your middle fingers, like so. You're going to have your index fingers and your thumb to guide you. And then same thing, gently go down in between the tooth, swipe up and down 2 to 3 times, go to the next tooth, C-shape, and back and forth. And that's it. That entails with the floss technique, brush technique. So no matter what age you are, it's very important to take care of your teeth. You're gonna need them for a long time. Hope Dental Clinic is a free clinic here in Minnesota, and we are able to offer over $2 million worth of free dental care to people in our community. And we're only able to do that with people that are able to volunteer, also with our donors. And if you're interested in volunteering or making a donation, please visit our website at hopedentalclinic.org. Thanks, have a good day.